You know those stretches that you've been doing for your lower back pain? Well, believe it or not, they might actually be making that pain even worse. Now, this is because not all back pain comes from the same cause, and therefore it can't all be treated with the exact same exercises. In this video, my goal is to show you the best stretches that you can do for your specific pain to help you to achieve better results. And I'll do it right now. What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, ToneandTighten.com. You know, there are a lot of great stretching routines here on YouTube, but they all seem to miss the mark on one very key aspect, and that is that not all low back pain comes from the same cause, and therefore you can't treat all of it the exact same way. For example, if your pain was coming from a disc bulge, I would make different exercise recommendations for you than, say, my next patient who might have threw his back out over the weekend. The truth is there are good exercises that should help you to feel better, but then there are also bad exercises that may make you feel worse depending on the cause of your pain. In this video, I'll not only show you 10 of the best stretches that you can do for your lower back, but also explain which exercises you should perform or avoid depending on the exact cause of your lower back pain. Now, the key to seeing success with these exercises and helping to treat your lower back pain is consistency. Simply put, the more you perform them, the better you should feel. Come back to this video daily, follow the routine all the way through to the end, and I know that you'll see the progress that you're after. My wife has agreed to help me to demonstrate these exercises. Let's get into them right now. All right, we're going to get things started with some gentle rotation stretches. Now, in my experience, most pathologies can handle these stretches as long as you keep them gentle and as long as you keep them in a pain-free range. So the first thing we're going to do is a double knee rotation stretch. Camille's laying on her back, both knees are bent. She's going to keep both knees together and simply drop them over towards you guys as far as pain would allow. I want you to keep it comfortable. I want you to go to pain, but not into pain. She's going to hold it 20 seconds to the left. She's going to come back, and then she's going to hold it 20 seconds to the right, and then we're going to repeat that 3 times. Again, a good, gentle stretch that should be suitable for most pathologies. Exercise number 2 is going to be a little bit more aggressive form of that rotation stretch. Now what Camille's going to do is straighten out her left leg with her left hand, grab the outside of her right knee, and then she's going to pull that over towards you guys. You'll see here that we're just introducing more rotation into the lower back. She's going to hold that for 20 seconds, and then she's going to come back the other way. Straighten out the right leg, left leg is bent, right hand pulls the left knee over to the side. You're going to get a good stretch up here through the quadratus lumborum. You're also going to feel that through the glute and through the piriformis muscles as well. Try to keep it comfortable. Remember to take some deep, relaxing breaths while stretching. Usually about 3 breaths or about 20 seconds of holds is what I go for, and we're going to repeat that 3 times. Next, let's get into another gentle stretch. This is a single knee to chest stretch. She's going to kick her right leg out straight. She's going to give her left leg a big hug and pull that up into her chest. Now, if you have degenerative disc or arthritis or stenosis, this is one of my favorite exercises for that. Also, mechanical low back pain or just a general low back pain, go ahead and switch to the other side. 20-second hold there, 20-second hold here. If you do have a disc bulge, this one's kind of a proceed with caution. Keep in mind that it might feel good to stretch your back out, but it might be aggravating to your symptoms as well, so keep that in mind for this exercise. If this feels good, exercise number 4 is going to be a double knee to chest stretch. Now she's going to grab both knees and pull them up into her chest. She's going to breathe nice and deep, nice and relaxed, in through her nose, out through her mouth. Hold that for 20 seconds. Relax, lay off of it, and then we're going to do that one 2 more times. The same principles apply to this one. Stenosis, arthritis, degenerative disc should love this stretch. If you do have a disc bulge, proceed with caution on this. Keep in mind that it might be aggravating. If it is aggravating, go ahead and skip that one. Okay, next stretch that we need to work on is going to be the piriformis stretch. Piriformis is a hip rotator that gets tight in most lower back cases that I see. To perform this, Camille's going to cross her left leg over her right, and then with her hands, she's going to sneak down and kind of grab around the back of her right leg, pull her right knee up into her chest until a good stretch is felt deep in that left glute area. Again, 20 seconds on the, so this is a stretch to the left leg. She's going to hold this for 20 seconds and then cross it up the other way, just like that. Hold for 20 seconds on the right leg. Now, in my experience, this one's actually pretty good for most pathologies. We are introducing a little bit of flexion into the back, so if that aggravates your bulged disc, again, proceed with caution on this one. All right, next let's jump into some hamstring stretches. Those hamstrings can get tight, they can pull on the pelvis, and they can cause pain. My favorite way to stretch those out, I'm going to grab this stretch out strap. You can grab a belt, a towel, a sheet, a dog leash. There's a lot of things that work. If you do want one of these stretch out straps, check the link down below. I've got it linked in the description. It is a nice thing to have, I'm not going to lie. Camille's going to grab those handles with her hands. I'm going to help her to put this right around her foot. There we go. Straighten your leg out. This leg is going to go down straight. And then nice and gentle what she's going to do. So back off of it just a little bit. Straighten the leg out. And now pull just until we get a good stretch through that hamstring area. Now, so we're going to hold this for 20 seconds. We're going to repeat it 3 times on the left. We're going to repeat it 3 times on the right. The only word of caution that I'm going to give about this one is you disc bulge patients or you herniated disc patients. If you do have sciatica, if you do have radiculopathy that goes down your leg, numbness, tingling, things like that, this one can potentially cause pain. So if that's your pathology, proceed with caution with this exercise. So again, 3 times 20 seconds on both sides. And that is going to be your hamstring stretch. All right, next we're going to roll Camille over onto her stomach. Let's see, according to my calculations, this is exercise number 7 that we'll show you, and we're going to get into a prone on elbows, proceed up into a cobra pose with this. This one is great for disc bulges. This one is horrible for arthritis and stenosis and degenerative disc disease. So please keep that in mind. If your pain is coming from a disc, great exercise for you. If it's arthritis or stenosis in your lower back, it does not like this extended position. She's going to hold that for 20 seconds. If this feels good and she feels like she can press up into even more of a stretch, we're going to go all the way up to what we'd call prone on hands or that full cobra pose. Her goal is to straighten out those elbows, to arch through her back, but to keep her hips down on the ground. If your hips start to arch up off of the table or bed or ground or whatever it is that you're on, just introduce a little bit of a bend in your elbows so that you can successfully keep those hips down. 20-second holds, repeat that 3 times. Okay, up next, let's get into a child's pose. So Camille's still going to be face down. She's going to be in this prone position, but now we're going to tuck her knees up underneath herself. She's going to reach forward into this position right here, and basically our goal is to round out the lower back as much as possible. This one is going to be great for you degenerative discs, stenosis, and arthritis patients just because it opens up your lower back so much. If you do have a disc bulge, you may or may not be able to tolerate this just because it puts pressure on the front of your disc, which causes more of the fluid to push into the backside. So, disc bulge, proceed with caution on this. Camille's going to hold this one for 20 seconds. She's going to repeat that one 3 times. Up next, we're going to jump right into a cat-cow or a cat-camel. So she's going to sit up here on all 4s. And the goal here is to just introduce some motion into the spine. So she's going to first round her back. I tell people, pretend you've got a string tied to this area right here, and it's pulling you up towards the ceiling. Nice and round this way, the hips tuck underneath her. She's got the chin kind of down into her chest. She's going to hold this for about 5 to 10 seconds, and then she's going to go down the other way. Looks just like that. So that first one, that was the angry cat. Now we're getting into the cow or the camel pose. This big sway back posture. We're introducing extension all through the back. So the hips roll down, the head comes up, and we focus on extending through our lower back. The cue that I would give you on this is go into as much pain-free range of motion as you have available. You should be able to do this with pretty much any pathology as long as you keep the movements small and out of the pain range. So on this one, I typically recommend that you hold each pose for about 5 to 10 seconds and you perform that 10 times. Our final stretch is going to be for hip flexors. Just like the hamstrings in the back can cause the pelvis to pull on the back and cause pain, so too can those hip flexors pull on the front to pull you into this anterior tilt and cause pain in your back. So Camille's going to keep her right knee down on the ground. She's going to bring her left leg forward into this kind of tall kneeling position, and then she's going to lean forward onto that left foot until she gets a good stretch through that right side of her hip. She can even fire this right glute to pull the hips backwards so that it introduces more of a posterior tilt and more of a stretch in through that hip flexor area. In my experience, this one's actually pretty good for most pathologies, but as in all of these that I've showed you, if it hurts, go ahead and either lay off it, keep it in a pain-free range as much as possible. If you can't do that, go ahead and nix it all together. Good job, babe. You passed. And so on the hip flexor stretch, we're looking at the same thing. We're looking at about 3 times 20-second holds on each side. Now, the key with these stretches is we don't just want to stretch. We want to follow those up with some great lower back and core strengthening exercises and activities. If you're interested in videos to help you to strengthen your core, I've got a whole playlist of them sitting right here, right now. If you're looking for more great stretches to just improve your general flexibility, those are them right over there. If you're looking to subscribe to Tone and Tighten, I hope you found this useful. I hope you subscribe to the channel. Hit this circle button right here. And until next time, we'll see you again right here on Tone and Tighten.